What is Mohs surgery? Well, Mohs surgery is a technique that allows us to remove skin cancers from areas where we want to preserve as much healthy tissue as possible. For example, the face. Generally, what will happen is you'll come up to the clinic. It's used as a treatment for common skin cancers such as basal cell carcinoma, squamous cell carcinoma. We will remove the skin cancer with a very narrow margin, particularly useful on areas like the nose or the eyelids where we really want to preserve as much of the healthy tissue as we can. Then rather than stitching the area up immediately, you'll go to the waiting room, you'll have a dressing in place, and you'll be waiting for around about 2 hours whilst a technician prepares microscope slides. I will then read the microscope slides, and this allows me then to determine if the roots of the skin cancer are going any further. And by correlating what I'm seeing on the slides with a map that I have, I can understand where those roots are on your face, go back and just take specific areas where the skin cancer remains, and that allows me to have very high degree of confidence that the skin cancer has been removed. Generally, the cure rate with Mohs surgery is more than 99%, but to remove as little of the healthy tissue as possible. And this will take, on average 2 or 3 goes. So you would expect to be in the clinic for at least half a day, sometimes a whole day. So make sure that you bring something to keep yourself entertained, a book or your laptop. Make sure that you bring food and drink. You should eat and drink as normal throughout the procedure. At the end of the Mohs procedure, the skin cancer will be fully removed and there will be a hole that we need to repair. And the best way to repair that hole is going to depend on where it is on the face, how deep it is, how big it is. So for example, on the cheek where there's quite a lot of lax tissue, often just sewing up as a straight line is a good option. The scar will generally be at least 3 times as long as the hole. On areas like the tip of the nose or the wing of the nose, then there's a lot less loose tissue and we can't usually bring it together just as a straight line. So other options would be sometimes something simple like allowing it to heal by itself, taking a skin or cartilage graft, for example, from the ear, or doing what's called a skin flap. And when we're talking about a skin flap, what we really mean is that we're making longer cuts to slide or flip in skin from nearby. So for example, for the wing of the nose, we might make longer cuts along the side of the nose to flip skin down to plug the hole, or use skin from the cheek. Now this does mean that you may have a longer scar than perhaps you're expecting, but it does allow us to replace the missing skin with the skin which has got the same texture and appearance and overall can give the best cosmetic outcome. So in summary, Mohs surgery is a very effective treatment for treating facial skin cancer. It has a very high cure rate and most patients find it very tolerable and get on fine with it.